and half year old boy. His name is Adam. Adam is 2.5 years old, and Adam's mom has concerned that Adam does not mix with other children, and Adam is not understanding toilet training. So mother is concerned. So Dr. Babur, you tell me, how many domain is affected in this child?
And social and speech both. Maybe some he has some gross motor also, or maybe some fine motor also. Maybe it seems to be.
I told you just by seeing three line. I'm not telling you.
Madam, this is social and behavior.
Yes, it is not speech.
Autistic child, madam.
You already know this is autistic. Oh, I'm very disappointed. This is the criteria of fail in exam.
Yes, madam.
Why you not? Now I will change the case.
No, I don't know, but when you write this one, that he's not mixing and not understanding, these are the two domains which are in the behavior and communication. So these two things are coming in the children. Those who are not mixing and they are playing alone, along with they have this problem with the interacting and they are not giving attention to the attendant who is coming to them like this.
You cannot imagine, Dr. Babu.
Yes, exactly. Just thinking.
Okay. How many varieties of cases they will
maybe autistic spectrum disorder.
Yes, that's by seeing this three line, never ever assume it's an autistic child.
Exactly, madam.
I asked you actually the question, what domain is delayed? I didn't ask you the diagnosis. I asked you what is the domain. What is the domain?
Yes, madam.
Tell me, what is the domain?
Domain by social and speech.
Behavior. Yes. Speech I did not tell you yet.
Yes, madam.
In this three line, first of all, everyone, I'm not talking him only. I'm talking with you guys, everyone. When there is any command, this three line command, you have to understand the domain problem. Which domain the child has problem. Now, maximum of you after seeing three line will comment like Dr. Babu, oh, it is an autistic child. But when you enter into the room, you are asking history, mother will not give you any history of autism. Then you will become puzzled.
Yes, madam.
Even without autism, a child can have cognitive impairment. This is a cognitive impairment child. He cannot express the need. So maybe he has speech delay, maybe. But now it is showing that he has social delay. So a 2.5-year-old boy Adam who does not mix with other kids and does not understand toilet training or he does not indicate toilet need to the mother. A 2-year-old can indicate toilet need. Okay, not expressive, but they can indicate.
Yes,
it's 2 year, 2.5, it is not understanding toilet training. Okay. So this child is actually wait, I'm increasing a little bit more age, 3 years, because toilet training actually comes at 3 years mainly. So I'm increasing the age 3 years, okay? This is we call it cognitive impairment. Cognitive means speech and social impairment. Although I don't know this child has speech delay or not. Okay?
Yes, ma'am.
Okay. So your command is cognitive assessment. So the examiner is telling you command is cognitive assessment. So cognitive assessment means you have to assess speech as well. Speech and social. So I will give you an easy case, but don't stick that it is an autism child. I may not give you an autism child. Okay.
Yes,
okay. So I will tell, wait, you take 1 minute, then I will start your timing. Take 1 minute, okay?
Okay, ma'am.
Okay, Dr. Babu, your time starts now.
Yes, ma'am. First of all, I will enter the room and hand over my mark sheet to the examiner, and I will ask.
Some park. He's alone. He cannot mix with other children. And also, doctor, I'm trying to make him potty trained, but he's not understanding potty trained. Okay. If I remove the nappy, he will do poo everywhere.
Okay. Since when you have noticed this problem with Adam, can you explain me or describe me more about it?
I noticed this doctor since birth. I mean, he never mixed with other children. But yes, like in first 6 months or 8 months, he had social smile. So he looked at me, he smiled at me. But now he lost that as well. He's not looking at me. He's not smiling at me.
But before that, he was okay. He was smiling and everything.
Yes, doctor. Before, I think 8 months. At 8 months, I noticed that he lost his smile.
Okay. And is it increasing gradually, or it is the same, or it is reducing in some regression?
I think this problem is day by day increasing. It is not static. It is not going back. It is not like, I mean, his development and his social behavior is very unusual, and it's increasing. Yeah.
And he has any problem with any other, just like constipation? He has constipation.
He doesn't have any constipation, but yes, he had behavior like he hold his poo. So when he does his poo, it is massive. But the stool is not hard. It is not constipation, doctor. Stool is soft.
Okay, he is doing this in the places which are not normal.
Yes.
In school, alongside like that in the garden.
Yes.
And he did not tell you about that.
No.
The 8 months, like before he was telling.
Before 8 months, he was smiling.
Before he was smiling. Now he has any problem with any like intelligence like this? He is asking something and he don't understand like this.
He's very clever, doctor. He can make puzzles. He can make games. He plays with the toys, trains. He's very intelligent. I don't think he has intelligence problem, but he cannot express his need or he cannot express others.
And can you tell me about any pee problem he has?
No, doctor, but he pees everywhere. I mean, in the school, in the nursery, in the home, everywhere. If I don't put nappy, he will pee anywhere.
Okay. He has any problem with his joints problems like this? He has pain in the joints?
No, doctor, there is no joint pain.
Any skin rash?
No, doctor, there is no rash.
There is any repeated chest infections or do you see bug infection in the chest?
No, doctor.
There is any racing of the heartbeat?
I did not notice.
Okay. And is there any problem with this one walking upstairs and downstairs like this?
Doctor, he still cannot go upstairs and downstairs alone. He holds the support. I mean, he needs support. Like he holds my hand, then he go very slowly.
He has any previous admissions in any hospital like that for some condition?
He had actually one time he had fits, so I got admitted fit was resolved in 2 or 3 minutes. So I went to GP. Okay.
Okay. At what age this fit was started?
It was happened like two months back, and I went to GP, and GP gave me some bacalmidazolam. GP said that if there is again happened, then I should use this. But the bacalmidazolam, GP said to give after 5 minutes, but his fit was not 5 minutes. It was very brief. It was like 2 to 3 minutes.
Nice. So when it was having the fits, he has fever also?
No, doctor, there was no fever.
And how long it was stayed this one?
I told you, doctor.
2 to 3 minutes. Yes. And then only bacalmidazolam was given, and he was not admitted at that time.
No, doctor, he was not admitted.
So before the fit, what he was doing? Can you explain me?
He was playing, doctor. He was playing alone. Suddenly, I noticed that he's having jerk, and after 2 to 3 minutes, he recovered, and then that did not happen again. So it was like 2 months back.
Okay, and then he has after this one, after the fit, he recovered completely, or there is some other abnormal posture or unconsciousness or
No,
PM,
it was complete recovery.
complete recovery. And he took with another medication or anything.
No, doctor, he doesn't take any other medication.
So the admission was not done, no investigation was given,
No, doctor.
and any no team involved in his any time.
No, doctor.
So is there any other previous admission for any purpose for this?
No,
for
doctor.
Adam?
No.
No. So he is any allergic to any medicine.
No, doctor.
What about his height and weight? It is going normal.
His height and weight, yeah, I'm concerned actually because he's a little short, I feel. But GP said that he's too young to identify short and tall. And I measured the head also. So GP said his head is also a little bit large in comparison to his body.
Okay, you do have any developmental concern except this one, other one, only this one, not understanding the toilet training and like this.
He is actually, doctor, he cannot speak properly. He cannot express his needs. He says like whatever he likes, suppose dog or cat. He says this, but he doesn't come to me or, he doesn't sing a song. His friends, his kids in nursery can sing nursery rhyme, but he cannot. And he does not express his needs. This is also my concern.
Okay, can he hold anything in his arms, just like palmer grabs? Or...
Yes, doctor, he can hold puzzles and he can make puzzles. 6 minutes gone, okay, Dr. Babar, you have 3 minutes left only. He can hold puzzles. He can make like 6, 7 cube towers.
Does he have any allergies to any medicine?
No, you asked this question twice, no.
Vaccination he has been done, he has got jabs properly. But...
Doctor, I did not give him any vaccine because in my family, there is a history of epilepsy after giving vaccine. So I prefer not to give any vaccine.
Can you describe me for family for me?
My family, doctor, he's my only son. And me and my partners are not living now together. But in my partner's family, there is my partner's brother, actually. He is paralyzed and bedridden at the age of 20 year, one of my partner's brother, ex-partner, and we are not living together. And yes, doctor, I'm very much struggling for Adam because Adam started nursery, but nursery cannot cope up because he's doing poo and pee and he's not telling anything. He's running out of the class. So nursery is telling me to arrange a special nursery. But as a single mom, it is very difficult.
Okay, yeah. I can understand, but you can tell me about your finance. Who is the earning member of the...
I am the earning member because when he is in nursery, I go to job. But as he's not going to nursery now, it's very difficult. Yeah.
You and your partner living together or no?
I already told you, doctor, we are separated.
Who take care of this child at home when you are not at home?
Yeah, I sometimes hire the nanny, but nannies are very costly. So most of the time I give Adam to my neighbor house or my mom's house, or I pay the neighbors, of course, and my mom. And sometimes my ex-partner, he takes care 1 or 2 days weekly.
In the nursery, he is okay with the nursery, or there is some problem at home?
No, he's not okay at nursery. He's running in the nursery. He's he doesn't understand the need. He doesn't express that he's hungry. One day his hand got hurt by some he got some hurt on the hand, but he did not tell anyone. And when he came home, I noticed that there is a minor injury in the thumb. So he does not express his pain. He does not express his suffering.
Okay. Can you tell me about how it affects you and your family, this disease?
Me and men, of course, doctor, it is suffering a lot. It is suffering a lot. I mean, I cannot do job. I don't know what will happen to my child. Okay, your time is up, Dr. Babur. Please summarize your case.
Thank you. Today I examined Adam, who is 3.5 years old, and he is taking history. The mother told that Adam have some history of fits at 8 months ago, and which was I think only one time, and after that he was given some medication and he was got normal, and the GP did not have any admissions, and he has some problems with his speech and behavior. He is not able to properly speak with the mother, and he has some problems with the poo where he is doing his poo at abnormal places, and he don't know and he don't indicate for the toilet training that he has telling he wants, he will do it anywhere. And he don't have any previous admissions in the school, but only except one time he has some infection for what he was given some treatment. But I forgot to ask the treatment. What treatment was given?
There was no infection. I did not tell you any infection.
Bug infection. Okay.
I did not tell you any bug is there or not.
Okay. Then he is having no allergies and the birth history.
Don't tell me everything. Just tell me the positive finding in your case. I don't need everything because I heard the case. I heard your discussion with the mother. So don't tell me everything. Just say the developmental age. What is the problem of the development?
Yes, according to the normal age of the child is 3 years, and due to this not mixing and peeing and poo and not understanding, I think his developmental age is 1.5 to 2 years.
1.5 to 2 years. Why you think 1.5 to 2 years?
Because he is not indicating the toilet needs. For the child who is indicated toilet needs and he cannot speak 2 words together like this, he mess the words. He is not speaking properly, he cannot understand.
So his speech is how much year?
Speech is approximately 1.5 to 2 years also.
Okay, gross motor?
Gross motor, he can run, he can go upstairs and downstairs, maybe 2 years, like 2 to 2.5 years.
Okay, and fine motor?
Fine motor, he has this grasp is properly, he can grasp, and I did not scribble or circle like that.
So, what is the fine motor age?
Grasp with the grasp, he can grasp, this means 2.2 to 2.5.
What is grasp?
Palmer grasp, madam.
Palmer grasp comes at 2 to 2.5 years or 6 months? Palmer grasp comes at 6 months. Making tower comes at year. So the child is making 6 cube towers. He is at least 2 years in the fine motor. Okay, all right. I will do the correction later. Now, assess the child. Assess speech and social because your command is cognitive. So assess the child now. 9 minutes.
Okay. I will first of all, I will check for hello, mom, how are you? I want to examine the child. Is it, do you allow the child?
Yes,
okay for you?
Yes, there is no mom, okay? In the developmental station, there is no child. There is no mom, only the examiner and you. But suppose there is a child. Examiner will tell you, suppose there is a child. Now, your permission is given.
Yes, ma'am. Before starting the examination, can I ask some questions from Adam?
For Adam? Adam will not. Okay, ask.
Okay. Adam, how are you? What are you doing now? You are wearing a very nice dress.
He's not looking at you. He's playing with a car.
Right.
He's running the car.
Okay. May I know that this child can speak English now?
Yes, he can. He's an English speaker.
Yes. May I know that he has any pain anywhere in the body?
No,
Does he have having any hearing aid or vision problem?
no hearing aid, no vision aid. I don't know about problem, but I know there is
Okay.
no hearing aid,
Hearing aid, yes. And there is any hand preference he has?
no hand preference. He's using with both the toy,
Okay.
both the hand. Sorry, he's using his both hand.
Okay, very nice. Madam, you are playing with the toy. Can you give this toy to me? I will give you another toy.
He's not looking at you. He's not giving you the toy.
Oh, you are doing very important thing, but you are not understanding me. You are not giving importance to me also. Okay, Adam. Can you remove the socks?
He's not removing the socks.
Hmm. Can you help to dress with me? If I want to give you the dressing, he can do dressing with the help in dressing.
Examiner is saying no. He does not extend his arm. Mom has to help him. Mom has to help him in putting dress and undress.
So he can have any some can drink with the cup or like this, hold the cup.
He can hold the cup, but yeah, he can hold the cup, but he prefers bottle. His bottle.
But he can also use the spoon.
No, he doesn't like to use spoon. He can use a cup, but he doesn't like to use spoon. And he use finger. He use finger for feeding.
Finger for feeding. Does he has any problem with this toilet like this? He can indicate the toilet needs.
No, he cannot.
Even he's dry by day or no? He
No,
cannot.
not dry by day. He wears nappy 24 hours.
24 hours. So in terms of play, can he play peekaboo, bye bye, petacade?
No, doctor, he doesn't do this peekaboo bye bye, but he knows bye bye because sometimes he says bye bye to other dogs or cat, but he doesn't say bye bye. If you say bye bye, he will not answer you, but he understands what is bye bye.
But he can have a pretend play or solitary play only.
How you know? How you will?
He is sitting and playing only alone, or he can play with his friends also. And whenever he is going to the nursery like that, he plays with his
No. You become another child, okay? And you try to play with the child.
Hello, Adam. I will give you this toy, can you give me this toy or play with me with this toy?
So his play is mainly solitary. He's not playing with you. He's not sharing his toy.
Okay. And he has some any parallel play. If I am playing, okay, I will play with you. Can you play with me like this? Or he can see that a spectator play that anybody is playing, and he can play with the looking at the spectator, looking at the child that they are playing.
Yes. So when you are playing, so you will tell the examiner, sir, I will also play with the car. Is he looking at me? I'm running the car. Is it looking at me?
If I will play with the car, is he looking with me at me?
Yes, he is looking sometime in the car, but most of the time he's not looking. But sometimes he's looking at the car. So he has some spectator play.
So can he wash his hands?
No, doctor. Mother helps him to washing hand.
Can he tell his name? If we will ask Adam, what is your name? Can you tell me your name, please?
No, he's not saying his name, but mom will help you. Mom says that doctor, he knows his name and he can use one word. He can use his name. Sometimes he says Adam. Adam, he says voluntarily,
Right.
not to other people. He says to himself, Adam. So he knows his name, that his name is Adam.
Can you join two words like this? Adam, give toy.
No, doctor, he cannot join
big
two.
bus. Not.
No. He has a word bank, like he knows like 10 to 20 word. He knows, but he will say single word. He will not say multiple word and not together.
So for his needs, he tell the mother that give me this thing, or he is indicating with the hand of the mother that give me this thing.
He doesn't indicate the need. So if he needs something, he will take mother's hand and then he will cry or scream.
And his speech is monotonous, or there is an intonation also there. Just like he's speaking that he has no high voice or low voice, like that. He's speaking in a one tone.
Yeah, his tone is monotonous. Yeah, he speaks in a one tone, doctor.
And is he having an echolalia, that if he see anything or hear anything, he is repeatedly saying the same words?
Like no, he doesn't have echolalia, but he sometimes says some phrases, some words that is not matching. Suppose he will say Adam suddenly, but nobody is calling him. So this is called scripting behavior.
Yes, he has rituals also, that he is stick to one ritual that he will do daily. If
you are assessing cognitive and social. So don't ask question that is not a part of cognitive and social. You have to follow the domain. Which domain you are doing now? Speech domain or social domain?
Speech
domain. Which part you are asking? You ask echolalia, okay?
Yes, and then sentences he can make.
Word and sentences you finish.
He can sing a song like that.
Yes. So you are diverted from the domain. Okay, you cannot divert from the domain.
Yes, ma'am. He can sing a song like that.
No, doctor, he cannot sing a song.
Okay, can he follow the two words order like that? If I will give this toy to Adam and tell to go give to the mother, can he do that?
Okay. So you are giving a toy and you are telling to give it to the mother. No, yes. He's not taking the toy from you. He's not going to the mother.
He's not interested. He's not have. Okay. Can he tell us the body parts? If I want to ask that, Adam, can you tell me what is this? This is my. I am giving him to telling him the nose, showing my nose that this is nose. Can he tell the body parts?
No, he's not showing. You're not pointing you anything. But mom is saying that he can understand 2 to 3 body parts. Like he can understand his tummy. He can understand his tongue. Okay, 2 to 3 body parts he understand, but he will not tell you if you ask him.
Okay, if I will ask some preposition in a simple way that put on the table this cup, can he understand his prepositions?
No, he doesn't understand preposition.
Okay. Then if I will ask some verbal and non-verbal cues, he can understand that if
this is which domain? This is which domain? You are again diverting from the domain. You
communication.
There is no domain for communication. There is domain for speech. There is domain for social. You are doing which domain now?
Speech finished now, I think so.
Speech finished. Social?
Social, I have to call just like playing, washing, feeding, dressing, all.
You did. Okay, finished. Present your assessment. Yeah, present your assessment one by one. Yes. First, tell me speech. What is the age of the speech?
Today I examined a 3-year-old boy, Adam, who can give his name only. He cannot tell his age, sex, and in case of the sentences, he cannot join the 2 sentences. And he's unable to sing a song. And he has some problem in assessing the command like this. If I will tell him to give something to the mother, he cannot understand like this. And for the body parts, he can only understand 2 to 3 body parts cutting to the mother, but he cannot understand the preposition. And for this In social domain, he have
No,
only
no. I asked only speech. So tell me, what is his speech developmental age?
it is according to the speech, he has 1.5 to 2 years.
Okay. And what is his expressive speech age and receptive speech age?
Expressive, he can express 2 to 3 parts of the body, means he has 1.5 years approximately, because he cannot express that this is my nose and like this is 1.5. But for understanding, up to 1.5 to 2 years, that he can name, but he cannot name properly. Yes, 2 words he cannot join.
So he's not 2 year.
If
If
1.8, 1.5, 2 years.
he is not 2 year for expressive.
Yes,
Again, tell me, what is his receptive age? What is his expressive age? Correct yourself.
Receptive age, madam, it is approximately 1.5 to 2 years, and expressive
Why?
1.5.
Wait, don't run like a train. Receptive age, 1.5 to 2 year. Why?
Because when he can tell the 2 to 3 parts of the body.
Receptive means telling. Do you think
Receptive means he can see.
telling?
Expressive means, madam, he can express something.
So why you are not mixing to both the thing? I'm telling you receptive, and you are saying that he's telling me. Receptive is not telling. Receptive is understanding.
Understanding, yes, madam. He can understand
why?
2, 3 parts like that.
Okay, he can understand 2 to 3 body part. Okay, this is receptive. That's why you are saying
it is 1.5 to 2 years.
Yeah. Okay. Is there anything other than body part? Anything receptive language?
No, madam.
What are the domain of receptive language? Which
Uh,
one you check for receptive language?
He has to tell the.
Again, telling. You're saying again telling. Telling is expressive. Receptive is
Yes.
not telling.
Yes, madam.
Which
Can you show me your eyes? Can you point?
Body part gone. Leave body part.
Madam, at least because he is 3 years, he has to sing a song.
Sing a song is receptive language.
No, madam. This is expressive. Sentences are 2 word sentences. He cannot.
It's receptive language.
No, madam. This is also expressive. He can express like this.
Allah.
Very bad. Madam.
Yeah. Very bad actually.
Yes, no doubt.
Okay, so receptive language other than body part. You know anything receptive language other than body part?
Madam, at 3 years, you cannot.
Why at 3 years he cannot do any receptive? Okay,
Sentence making and
receptive.
sentence making.
What is his expressive age?
Expressive age, madam, it is 1.5 years, 1 to 1.5 years, because he has some ukulele only. He's speaking only one word like this, and he's not joining the words, and he is unable to tell the parts of the body. He cannot do the prepositions. He cannot tell that in and on. In and on, this, madam, this is also receptive. Yes, preposition. But
is his age appropriate for preposition use? He can
no,
use
madam, 3 years. 3 years preposition, 2 words, madam, in and on like that.
Preposition, to preposition comes at 3 years. Yeah,
Yes,
that's
madam.
preposition.
Yes, madam.
Complex preposition comes at more than 3 years.
Yes, madam.
Yeah. So preposition is receptive. Yes. Body part,
Yes,
showing body part is receptive.
No, if he's only understanding the body parts, then it is receptive. If he can explain that this is my nose, if I will point what is this, then if he can say it is nose and it is eyes, then this is expressive.
Very good. Order. Following order is also receptive.
Yes, madam. But he's not following any order actually.
So why did not you say order? You are stuck on the body part.
Because he was not understanding any command like this.
Yeah.
He was very equally and everything.
That's why you say the examiner. That's our, I gave him order. He could not follow 1 order or he could not follow 2 order. So his maximum age is below 1.5 actually. He's 12 month to 15 month. He's not even 18 month. He's not following any order.
Yes, madam.
Any order. Then name, age, sex, these are all expressive. Sentence making, word making, sing a song,
Yes,
counting, color. You did not ask any counting or color to the child.
because it is coming after 4 years like that.
Yes, counting comes at 4 years, but
Yes,
as the color less than 3 color, suppose red, less than 3 color can comes at less than 3 years. Sorry, less than 3 color can comes at less than 4 years. So you could ask at least you could ask any color. Counting, yes, counting 1, 2, 3, 4 to 10 comes at 4 years.
Yes, madam.
But below 4 years, we will try counting and color. If the child is 3 years, we will try. He will not do 1 to 10. 1 to 10 comes at 4 years, but 1, 2, 5, this comes at below 4 years. Okay, so order and preposition, body part. You did not ask property, but property comes at 4 years.
4 years, yes, madam.
And opposition also comes at 4 years. These are all receptive language. Okay, so examiner asked you what is the receptive domain. You could not say what is receptive domain. You are repeatedly saying song, body part. Okay,
Yes, madam.
sentence. So you forgot the receptive domain. And in expressive domain, you say the child is 2 years. Actually, if the person cannot make 2 sentences, 2 word, he is not 2 years. He is below 2 years.
Yes, 1.5.
Okay, so what is the social domain? You in the assessment part, Dr. Babur, you mixed up. Sometime 1 minute you are doing social, 1 minute you are doing speech. This will be very downgraded. Although you completed in 9 minutes, but this will be downgraded. Examiner will cut your 2 part here because you are not following the step. You are jiggling between the domain. Okay.
Yes,
so if you listen to the recording, you see there are sometimes you are asking the hand wash, toilet training, sometimes you are asking the sing a song. So that means you are mixing both the domain.
Yes, madam.
Tell me what social domain you asked for this child and what is the age of the social domain?
Madam, he can hold the cup only in this, and he cannot hold the spoon properly. And this means, and then in the dressing, he is holding an outstretched hand. He is helping the mom in the dressing. But for himself, he cannot remove the shirt or socks like this. And he don't have any indication for the need that he want to go to the toilet like that. And for the playing, he has only solitary play. He's playing alone. And according to this, I think so. He has 1 to 1.5 years.
He was running the car. Okay, what is this? Running the car. You saw him running the car. What is this?
Yes. No, this is just like a symbolic play, solitary play.
It's a symbolic play. Yes. So running the car is a little advanced, and he was solitary, and he also was looking at you a little bit when you're running the car, right? So spectator.
Yes, madam.
He has
this all comes at 1.5, 1 to 1.5
years. And his mother said that he understand bye-bye. He will not say bye-bye, but he understand bye-bye. Yeah. Peekaboo, patty cake. This play
Bye-bye, yes.
This play are possible in lower age. This child is a higher age group. Okay, he's doing some pretend play. Sorry, he's doing some solitary play, spectator play. He's doing some symbolic play. So the peekaboo and patty cake is not our big deal. And mother already told you that he understand bye-bye. So that means he's advanced than bye-bye.
Yes.
But you did not try more advanced play. When the child is doing solitary play, some spectator play, not obvious spectator, but some spectator and symbolic, then you should start next step. You did not go next step. Next step is
Share toys or pretend play.
parallel play. Yes. So you did not try parallel play. You should ask the child, Adam, let's have a race, okay? This is my toy. This is your toy. Let's race. Boom, boom. Let's race. Sir, he's playing with me. He's making parallel play.
Yes.
Imaginary play. Imaginary play. You take a suppose a thing like a remote control or something that is long, and you act. You do some play like suppose you take some toy and you make it as a like let's cook. You take a cup. Let's make a tea. Let's cook. Let's make a tea. Okay. And you do not offer the child that Adam, can you make a cup of tea for me? Can you do? So imaginary play. Suppose you are imagining that you are making a cup of tea. Okay. So you did not offer this imaginary toy. Pretend, imaginary and parallel. This pretend, imaginary and parallel, they comes at 2.5 years.
Yes, ma'am.
Sharing toy, the child did not share with you. So sharing toy comes at 3.5, but the child did not share with you. So it's okay because he's not at sharing toy age. But pretend play, imaginary play, and parallel play, he was with the age. So you should talk. You should ask. So pretend play means suppose you are pretending something to something. Tamanna, you take one banana and use it as a mobile phone.
Yes,
So pretend means it is not a mobile phone, but I'm pretending it as a mobile phone. So I'm holding the banana in front of my ear and I'm asking the child, hello, Adam, how are you doing? Adam, now you speak to me. Give the banana to the child. See what he's doing with the banana. So is this everything you have to speak to the child, and you have to say to the examiner, sir, I will take this banana or I'll take this remote. I'll speak as if it is a phone, mobile phone. Is he using it? Is he doing same like me? I will offer him. I'll give the banana to him. So this is pretend play. Imaginary play, making a cup of tea. Imaginary play. Parallel play, let's have a race. Boom, 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 boom. Sir, he's doing this with me. He's playing a race game with me. This is parallel play. Parallel play means both the child, not sometimes playing together, but playing side by side.
Yes, ma'am.
Okay, he may not play together, but he plays side by side. That means you are also running the car. He is also running the car on his side. You are running the car on your side. So this is parallel play. Parallel play means both the child are playing together, but sitting side by side. Maybe they are not talking with each other. Okay, so this is parallel play. And more advanced play is group play, fantasy play, role play. These are more advanced, but this child is only 3 years, so I will not do group play, fantasy play, and role play to this child. And washing hands comes at 3 years, but this child moms helps him washing hands, so he cannot do washing hand. And brushing teeth comes at 4 years. This child cannot do brush his teeth. Indicate toilet need comes at 1 to 1.5 years. This child is actually does not indicate toilet need, so he is below 1.5 years. That's why I'm saying he is below 1.5 years. That means his maximum age is 12 months to 15 months. It's below 1.5. But in case of play matter, like solitary play, spectator play, he is 1.5. So you can say the examiner, sir, in social part, he is divided. He is using the cup, but cannot use spoon, so he is 1 year. He is not indicating toilet need, so he is below 1.5 year. He cannot off the shoe and sock, so he is below 1.5 year. He can understand bye-bye, so he's 1 year. Also, he can do solitary play, some symbolic play, so he is 1.5 year. So he's in the social column, play pattern, he is a little bit more advanced. He is 1.5 year in the play pattern, play. But in the self-care maniki, washing, dressing, brushing, this is self-care, toilet need. In the self-care, he is below 1.5. He's maximum, he's 15 months. Got my point?
Yes, ma'am.
So this should be your approach in the speech part, in the social part. Now, my exam is not yet finished. Tell me, what is the cause of this delay of this child?
Differential diagnosis, I can say it can be hypothyroidism, it can be autism, it can be some, just like he has a face, maybe he has some epilepsy because he was before okay, and then some
So you said epilepsy then?
autism and hypothyroidism.
Hypothyroidism. Okay. Is there any possibility of neglect or lack of
Yes,
stimulation?
ma'am, exactly, yes, ma'am, because he was giving this child to some neighbors, like neglect is one of the mid-domain differential diagnosis, because she is not taking care of someone, nanny or home mother outside the neighbors, they are taking care.
Okay. So lack of stimulation, neglect is a possibility.
Yes, ma'am.
And congenital hypothyroidism, the 3-year-old cognitive impairment, possible. But how can you match with congenital hypothyroidism with fit? He has one-time convulsion, although it was less than 5 minutes, but it was a convulsion, and it was afebrile. How will you fit congenital hypothyroidism and convulsion?
Epilepsy, actually, maybe the epilepsy he has not diagnosed properly. He has
Why you said congenital hypothyroidism? The child can go upstairs.
not congenital. Maybe he is having some hypothyroidism feature in differential diagnosis because he is having some he cannot properly special speech delay like this is coming with the hypothyroidism in differential diagnosis.
No. Speech delay with hypothyroidism, I agree. But why did you say hypothyroidism here? Is there any feature of hypothyroidism mother told you?
No, ma'am. Only on differential.
Okay, if mother did not tell you, how come you make it? You cannot invent any DD. Okay. So your differential is also incomplete because your history is incomplete. In history portion, I'll come later. Your differential is not complete. You'll get cut mark here because you did not tell about neglect. You did not tell about other differential diagnosis that is related with this child because of the fit. Epilepsy, you said, what epilepsy? What is the importance of head size? Mother tell you that head size is getting bigger. You did not explore other neurological problem of this child. Head size and epilepsy, there is a relation. Okay.
Yes,
your history was incomplete. That's why your DD is also incomplete. Okay. Now, what investigation you will do to diagnose this child? This child is having single domain delay or what? Which domain delay?
2 domains, speech and hearing and social both.
Okay. So what is this called? What is the definition of delay?
This is, this delay is hold this one.
You forgot the term, right?
Yes, ma'am.
Global developmental delay.
Yes, ma'am. Global developmental delay.
So this is the global developmental delay when there is 2 domain delay. You understand your preparation, Dr. Babu, right?
Yes, madam. Exactly. This is the reason I want to give to check my understanding is very bad. I am doing preparation, but it is very bad. Really.
Okay.
I will improve, inshallah.
No, now, inshallah, tell me, how will you investigate this child, global delay child?
For global delay child, we have to check for comparative array studies, chromosome comparative studies, Fragile X syndrome for diagnosis, Fragile X studies. Then we can do CK, TFTs, and then we can do some urea electrolytes or any then CK and for Wilson's we will look for the child, and for this one maybe some metabolic causes are there. We can evaluate for them also, and for the epilepsy we can do this if he has the EEG or and for the head size we will check for maybe some he has problem in the brain, MRI brain, and then normal investigations like this.
Normal investigation mane ki? What do you mean by normal investigation? What is abnormal investigation and what is normal?
Diagnostic, and just like electrolyte CBC. If we do some infection like this, head size is increasing.
Okay. MRI, right? MRI, RSG.
MRI. Yes, ma'am.
Okay, don't say TFT, okay? Examiner does not understand TFT. Examiner is not smart.
Yes, ma'am. Thyroid function test.
Thyroid function test. Don't say CBC, okay? Full blood count.
Yes, ma'am.
These easy things matters in exam hall, okay? So don't say CBC, it's full blood count, RSCGH or genetic analysis.
Yes, ma'am.
And then MRI of the brain. Don't say only MRI. MRI can be done in abdomen,
Yes,
in
ma'am.
chest. So say MRI of the brain. Okay? And say thyroid function test, metabolic screening, like organic acid. Say CPK. Say electrolyte, full blood count for to rule out infection. Okay? Vitamin D profile, calcium. These are baseline study for any global developmental delayed child. But you did not mention two investigation that is most important for this child.
I don't remember.
Vision and hearing. In any global delayed child, you have to do investigation for vision test and hearing test. Okay, now tell me, how do you manage this patient?
We will have some multidisciplinary team for this child, and we have to involve this pediatrician for this increasing head size for evaluation, and for the developmental pediatrician will involve, and some then a physiotherapist we can involve like this, and this speech and language therapy we have to give to the child, and some special schooling. He has to go for special school, and this.
What is the process of going to special school? What is this called? You again forgot the term, right? What is this called? Going into special school. What is this process called? Guys, please be careful. We can hear your home, your hospital. Okay. EHCP, very good. Educational Healthcare Plan, very good. So the child will go to special school or mainstream school that will be decided by EHCP, Educational Healthcare Plan, very good. Then, can I mention physiotherapy, multidisciplinary approach? What are the team member of? Who is the leader of multidisciplinary team? What are the doctors or specialists you will refer?
This developmental pediatrician for hearing and vision problems that we have to send for the ophthalmologist and ENT specialist, maybe psychiatrist, maybe speech and language therapist. We have to send the child, and maybe some he has some neglect also, so we can send to the social services also. We can involve.
Hearing vision assessment. Did you mention audiologist, ophthalmologist?
Yes, my ENT specialist and ophthalmologist.
Okay. Physiotherapist you mentioned, special school you mentioned, social service you mentioned, financial support you mentioned, and what else? Speech and language, did you mention speech and language therapy?
Yes, speech and language therapy.
You mentioned or I mentioned?
Yes, madam, I mentioned.
You mentioned, okay. Speech and language.
Developmental pediatrician and speech and language therapy.
Okay. So these are the multidisciplinary team. Then the examiner can ask you the role. Examiner will ask you that if you refer this child to only two specialists, where will you refer? Only two specialists.
Madam, speech and language therapist and along with the developmental pediatrician.
Very good. Yes, because this child has cognitive delay. So the main person is developmental pediatrician and speech and language. But practically, if you say who will help this child most? EHCP. EHCP.
Yes,
okay. EHCP will help this child most because this child needs support. This child needs a special school. He will not go to normal nursery because normal nursery cannot cope up his behavior.
Yes,
so practically, for this child, most important person is school. Most important institution is school. Okay. And therapeutically, most important person is speech and language therapy team because they will give Makaton sign. Oh, I did not ask you. Sorry, I already answered you. This child will be needing to use Makaton sign. Okay. There are British Makaton signs. There are universal Makaton language. So sign language.
Yes,
because he is not speaking much, no. So he will be given some sign language so that he can communicate when he needs toilet, when he needs food. We'll be communicating. So the speech and language therapy team is really very important for this child. They will show Makaton sign. They will teach the Makaton signs and this thing. All right. Okay. So in the history part, Dr. Babur, you missed how many points? I'm telling you.
Too much.
We discussed about first of all, you did not understand that this is history station. You started your assessment, but I told you that it is a full development, right?
Yes, madam.
So I told you 22 minutes. 1 minute is also given here. So this mistake you should not do in the exam hall.
Yes,
right? Where I'll go, what I will do. This you have to have a clear idea about the exam hall. Exam means exam. It's not a joke. It's not a funny thing, right?
Yes,
and it's not a terrible thing. It's not like bomb blasting going on. Exam, you have to take it practically and systemically. That okay, this is my station. After that, any station can come. I have to be mentally prepared. Don't fix your mind that madam said only assessment. No, full station. You have to prepare in your mind that this should be full station. During entering into the exam station, your time started. So the more you waste your time, the more you will lose your time. So when you enter into the room, bell actually clock started. So the total 22 minutes you will stay on that room. Neither 1 minute less, neither 1 minute more. So as soon as you enter into the room and as soon as you exit into the room, total time is 22 minutes. So going to the battlefield, you have to understand the battlefield. Every corner of the battlefield, you have to understand. Similar is exam hall. When you are going to any exam hall, you have to understand the exam hall. Okay, first. So as soon as you enter, there was a mother, there was examiner. You greet the examiner, you greet the mother, and you give the mark sheet to the examiner, and then you take permission, and then you sit down, and then start talking with the mother. How may I call you? You said, what is mother's name? We do not talk like that. In front of you, there is a mother. How you are talking? See how you are talking. You are in front of you, there is a person, and you are asking the examiner, what is mother's name? Where is the problem, Dr. Babur? You understand? Where is the problem?
Yes, ma'am. Exactly, ma'am. I have to ask to the mother that how
You
can
have to
I
ask to the mother that how
Yes.
can I address you? Very
ma'am.
respectfully. You have to
Yes,
ask the
ma'am.
mother, how can I address you? This is our problem. We are Asian. We do not know the culture. We do not know the custom. We do not know the, our communication is very bad. That's why. The mother is sitting in front of you and you are asking the examiner, what is mother's name? This is very bad. This
Yes,
is
ma'am.
disrespecting. You have to ask to the mother. Hello, introduce yourself. My name is Dr. Babur. I'm one of the candidate today. Am I speaking to mom of Adam? You did not ask these things. Did you ask this thing? No.
No, madam.
You did not introduce nothing. Then you should ask the mother, how can I address you? See, this two line, nobody can teach you. You have to understand that there is a person in front of me, and this is a living person. This is not an online exam. This is a living person in front of me. How should I behave with him? The respect should be at the top of your priority. You will get downward mark due to lack of bondage, lack of rapport. Yesterday, I took one class for mark sheet. Examiner cut the mark for not building rapport with the mother. You remember mark sheet
Yes,
class
ma'am.
yesterday morning?
Yes, ma'am.
So you will cut your mark. You will lose your mark by not asking the mother's name, by not giving you the name. Your name, you did not tell the mother that my name is Dr. Babur. You did not tell your name.
Yes, ma'am.
This first one or two line, this is a basic of any station, any communication station, history taking station, clinical station. This first two line that hello, my name is Dr. Babur. I'm one of the candidate today. Am I talking to Adam's mom? Yes, doctor. How can I address you, mom? How can I address you? Don't say mom, he's not your mom. How can I address you? Mom said, doctor, you can call me Sally. Okay, Sally, nice to meet you. Thank you for coming. This is rapport building. You did that? You did not do it.
No, ma'am.
You just asked permission that can I ask you some question? Mother said, okay. This is now not a good starting. This is a very, very odd starting.
Yes, ma'am.
Okay. From the starting, you did like blunder, one after another. Then you have to ask, okay, what brings you here today? What is your main concern? Mother asked you main concern. Mother told you main concern. Then is it very good? You did some good point that you asked that where is it progressing, regressing, increasing, decreasing? When you noticed, okay, what happened at 8 months? You all noticed. But at history taking, Dr. Babur, you were repeatedly asking same question. Mother is telling you that he doesn't indicate toilet need. He does poo and pee here and there. You again ask same question to the mother. Mother told there is no allergy. You again asked if you have same allergy. Mother already told you he's going to nursery, but you again asked, is he going to nursery? Then mother told you asked some systemic inquiry. Mother gave you, but you missed many systemic inquiry. That is very important for this child. What is the systemic inquiry you missed? Systemic inquiry you missed the birthmark. You did not ask any birthmark. This child had convulsion, and you did not ask any birthmark. You asked rash. Mother said no rash. Do you think rash and birthmark are same?
No, madam. Different.
English language, they are very particular. Okay.
Yes.
If you ask mother rash, mother will tell you no rash. If you ask mother birthmark, mother will say yes, there is some birthmark, because mother is a non-medical person. Mother does not understand tuberous sclerosis, neurofibromatosis. Am I right?
Yes, ma'am.
So mother will not tell you that doctor, there is birthmark. You forgot to ask me. Mother will not tell you. Mother is not a medical person. How mother know that this birthmark is related with neurofibromatosis or tuberous sclerosis? Mother is a doctor? No, mother is not a doctor. So for mother it is normal, but you did not ask. This is abnormal.
Yes, ma'am.
So any developmental station, I took class yesterday, just yesterday, that any developmental station, you must ask birthmark, head size, fit. Any abnormal movement, any fit, any birthmark, any head size, any unusual feature in the body that you think is not normal. You did not ask this question. So dysmorphism you did not ask. Birthmark you did not ask. Head size you did not ask. Head size mother voluntarily told you, but you did not
Yes,
ask.
ma'am.
Fits,
Mother also told about the family history.
yes, voluntarily, yes. So sometimes mother will tell you some voluntary history, but not all the time. Like here, you missed the birthmark. Mother did not tell you, and you also missed. This child is actually tuberous sclerosis child. You did not ask. Mother is saying, doctor, he had convulsion, and his head size is increasing. That means he has intraventricular tumor. At the age of 3, the baby started growing of the tuber, and the baby have started convulsion. This baby will have repeated convulsion soon. He's still not diagnosed. He will be diagnosed soon. But luckily, he came to developmental pediatrician early. You are the developmental pediatrician, right? This child will soon develop generalized tonic-clonic convulsion and intractable seizure due to intraventricular tumor, and he will have developmental regression that he started already. From 8 months up to 8 months, he was okay. Then the baby started loss of smile. He doesn't mix up with other kid. He doesn't talk to the mother. So from 8 months, his regression started. Okay. Developmental regression is very common in case of neurofibromatosis, tuberous sclerosis, Sturge-Weber syndrome, autism. This child has autistic behavior as well, because you know that tuberous sclerosis is associated with autism. You did not ask autistic quadrant, 4-quadrant question that are very vital. Red flag question. Does he look at you? Does he line up the toy? Does he have hand flapping? I told you there is an extra column you have to add for autism and ADHD children in the first column. Okay. So you should ask this question: is the child having repeated hand flapping, or is the child making lining up of the toy, or is he looking at you, or is he using repeatedly same word like car, toy like that, or is he having any empathy when you got hard? He shows empathy to you, he hugs you, he kisses you. You did not ask this at all. And then in the systemic inquiry, you missed important point. As I said, you missed birth history now. Birth history you did not ask to the mother. In developmental station, you must ask birth history, antenatal history, natal history, postnatal history. Although mother did not tell you any admission, mother said you that there was no admission required. That means birth history was normal, but you did not ask. Newborn hearing test, you did not ask. For a speech assessment, cognitive assessment, newborn hearing test and newborn heel prick testing is mandatory. You must ask this question. You did not ask. Got my point?
Yes, ma'am.
Yes. So then postnatal history, developmental history. Developmental history, you missed many points. Like gross motor, okay, he can go upstairs, downstairs by holding the hand. That means he's 2 years. Fine motor, mother voluntarily told you that he can make tower and he cannot use pen. So he can use big tower, but he cannot use pen. He does not use pen because of his autistic behavior. But he can make tower 6 cube. So 6 cube tower comes at 2 years. So fine motor wise, he's 2 years. Gross motor wise, he's 2 years. That is also delay. That is also not normal, because you said only speech delay and social delay, but you did not tell the examiner, sir, this child has all domain delay, because gross motor wise, he can only go upstairs and downstairs by holding the hand. He cannot go alone. So he's still behind. Fine motor wise, he is using 6 cube, making 6 cube, but he's still behind. At this age, he should make a train. He should make a tower of 9 cube. He should make a stair. He cannot. And at this age, he should make a circle. He cannot. So he's still behind. In the developmental history, you must ask other domain. This child's domain is speech. Domain is toilet training. So you should use speech and toilet training in the first column when mother's concern. You are expecting mother's concern. Okay, that is the first column. In the second column, when you are asking the other domain, you must ask 2 or 3 questions. You did not ask 2 or 3 questions. You only asked 1 question because you have to explore. In the gross motor, you did not ask the mother, can he run, can he jump, can he run, can he kick a ball, can he throw a ball. You should ask at least 2 or 3 questions to identify that the child has gross motor delay or not. Then the fine motor delay, you ask 2 questions, that can he scribble? Mother said no, he cannot use. You ask, can he use a spoon? Mother said no, he can use cup, but he cannot use spoon. So definitely he is actually below 2 year, 18 month to 2 year. In the fine motor wise, gross motor wise, he is also 18 month to 2 year. Speech wise, he is below 2 year because he cannot make 2 words. So he's 15 month to 18 month. In the speech wise, cognitive wise also, he is below 1.5 years. So he is 12 month to 15 month because he's not expressing the toilet need. He's not playing with other kids. So from the history also, someone asked me in the chat that, madam, should we take history for all domain? Yes, you should take history for all domain. The concerning history that the child has speech delay, you will ask in the first column. What is your main concern? Speech. Speech is my concern. Okay. What speech? How many words he can say? Yes. So this is your first column. And in the second column, in the developmental history, you will ask other domain. Other domain means gross motor, fine motor, and social. If your task is speech, you will ask speech domain in the first column and other domain in the second column. Got my point? Because immediately after taking history, examiner will ask you, okay, tell me, from the history taking, what is the developmental age? You have to answer the examiner, right? So you will say the examiner, sir, from history, I can see the child has more than 2 domain delay, so it's a global delay child. And Dr. Babu also forgot the terminology, global delay, right?
Yes,
you forgot the term EHCP. So if you forget this term in the exam hall, examiner will not give you a second chance.
yes,
Right? So this is a global delay child, and examiner will ask you, tell me which domain has delay, what is gross delay, what is fine motor delay, what is speech delay, what is social delay. So you have to answer each domain delay. Okay. Tuberous sclerosis point in favor. Tuberous sclerosis point in favor that Dr. Babu missed birthmark. This child has a birthmark, Ashley spot, cafe spot. This Dr. Babu did not ask at all. This child had convulsion at the age of 2.5 years, and he has developmental regression, and his head size is increasing. Also, there is a strong family history that you did not understand. Mother said, father's brother, paternal uncle is bedridden, wheelchair bound, bedridden from the age of 20, because he also sufferer of tuberous sclerosis. Tuberous sclerosis patients sometimes become bedridden because of the severe brain involvement of tumor, generalized tumor, and the person will become upper motor neuron paralysis and bedridden. So there is a strong family history of bedridden. So it is a genetic condition. It is autosomal dominant. It can come from father's side, from mother's side. That is also an important history that you missed. Epilepsy will not cause bedridden, right? Am I right? So you said epilepsy, but epilepsy will not cause bedridden. This is a child of secondary epilepsy due to tuberous sclerosis. In the history taking, you lost so many time because you are asking same question again and again. Mother told you he has problem in nursery. You again asked mother, any problem in nursery? Mother already told you, doctor, he's running out of nursery. He's doing poo and pee everywhere. He's not expressing his need. So nursery cannot cope up. So nursery people said me to give him in a special school. Then again, mother has to explain you. So you lost your so many valuable time in speaking same question again and again. Okay. This is my comment about history taking. And in the assessment part, the most important point I noticed that you are jiggling between station to station and you are forgetting the domain. You are asking too many questions that is not in the domain. Like you are asking repetitive behavior that you should not ask to the examiner at the middle. You should ask at the beginning. Sir, what is the child doing? Is there any abnormal movement? That you should ask in the beginning, not in the middle. And you are asking some other thing. I forgot. You are asking the autism domain, but you should finish the social part and then you should finish the speech part. Then you should ask some extra question that, sir, I can find that the child has some features of autism. So I want to know, is there any lining up of toy he's doing? Sir, I want to know, is there any hand flapping? Sir, I want to know, is he having any scripting behavior? So you should take permission from the examiner that, sir, my assessment is finished, but I want to ask some question related to autism. Got my point, Dr. Babu?
yes, madam.
Yes. So what is your comment, Dr. Babu? Was it, educational for you? You learned a lot or no?
Madam, I learned a lot. This is the reason I asked to take I am reading, but reading is something else and giving the examination is something else.
Very
I took this history, but the history is not proper. I know how to take, but whenever time bound, it's some things are forget and something we are going somewhere else.
Yeah. My correction is for your betterment. That
Yes,
from
exactly,
now,
madam.
whenever you will go to developmental station, you will remember that
Yes,
I
madam.
should strictly follow my columns. And when I'm doing 2 domain, I should not jiggle between 2 domain. I should stick to 1 domain, finish 1 domain, and then go to another domain. And other than anything other than domain, I have to take permission from the examiner. Sir, I want to do some assessment that is related with autism.
Yes, madam.
Okay. Yes, Dr. Salma has a question. Dr. Salma.
Yes, ma'am. Ma'am, I want to ask her command was to do cognitive assessment. So after taking development history, examiner will ask about gross motor and fine motor age or all that age.
In the history station, in this exam, my student gave exam yesterday, India.
Yes.
After coming from exam, she has said, madam, examiner asked me each domain age after history.
Okay, but ma'am, what we know, what you have asked, don't ask any question in history. When you will do assessment, then you will ask the question about that. So I am confused now.
The person who teaches you this, he or she is wrong. Because I always teach in my class that all the domain you have to ask, the task domain is in the first column and the rest of the domain in the second column.
So ma'am, we will ask only 2 to 3 questions or for the task domain or all the questions because it will take a lot of time.
No. What is your main concern? This is the question you will ask to the mother. This is the task. What is
Okay,
your...
then she said there is some problem in his speech. Then we will ask 2 to 3 questions related to speech.
Yes. You will ask some question. When it started, how it started, how many words the child can speak. At least you understand that where is the delay, how much delay. Okay. And then you go to the systemic inquiry, developmental history, birth history. What's my point? In the developmental history, rest of the domain, like gross motor, fine motor, you will ask. Detailed. 2 to 3 questions you will ask.
Okay. And ma'am, then what we will do during assessment?
You will do same thing. Sir, how many words the child can say? Can he join 2 words? I will ask him name. What is your, I'm a boy. What are you? I live in London. Where do you live? So this assessment you will do in the assessment portion. This is not you are asking the mother, right? You are asking the mother that what is the speech delay? What type of speech delay? Right.
Okay. How can we ask from the mother what type of speech delay?
Of course you ask. Type money. Why you said speech delay? What do you think about speech delay?
Okay. Thank you, ma'am.
Mother is saying you speech delay. You have to explore what is this speech delay? What mother understand about speech delay, right? Then mother will tell you, doctor, my child cannot join words. He can only say Adam, cat, dog. That means 1 word. Mother is telling you the answer.
Okay. Okay. And then during the development history, how we will ask about the social questions from mother?
Yes, of course. You will ask that, is he toilet trained? Dry by day, dry by night? These are questions you have to ask to the mother. The child has delay. Is he
Okay.
If you will ask this in the history, so we have to examine the patient also. The examiner will not say why you asked this question in history and you are examining the child.
No, no, no. You can ask. You can ask. Listen carefully. This idea that I will not ask the domain question, this is absolutely wrong. Years after years after years, people are teaching wrong thing. That's why I'm telling you that when you choose a teacher, please choose a teacher who knows, okay, who knows and who is seeing this patient. I have hundreds of mark sheet to my students and I have hundreds of comments to my students, okay, and every day my students are giving exam, every center, every country, and they're coming back to me and giving the feedback. So the idea of not asking this question in the domain, this is wrong. But yes, you have to follow a protocol. Like, what is your main concern? Mother is saying, doctor, he does not indicate toilet training. He does not need he doesn't understand toilet training. Okay, so can you tell me he's dry by day? Mother is saying, no, doctor. Dry by night? No, doctor. Is he doing, Dr. Babur, another point, Dr. Babur, you ask question in a indirect way. You ask question to the mother like that. Is he doing toilet here and there? And he's not telling you. Mother said yes. Don't ask question like that.
Okay,
ask mother like a direct way. Like, how does he poo? How does he do poo? Or how he does pee? Can you describe? No, doctor. Mother will tell you, doctor, he does poo and pee everywhere. He does not tell anyone. Okay?
Yes, ma'am.
Don't ask mother the question. I mean, this is called indirect question. Okay, ask mother direct question. Do not ask indirect question. Okay?
Yes, ma'am.
You sometimes you ask, there is no hospital admission, right? Don't ask question like this. You should ask, is there any hospital admission? Mother will tell no. Did you give vaccine? Mother said no. What was the birth history? Can you describe birth history? Don't ask birth history is normal or Caesar. Don't ask like this. This is called bad questioning. Bad questioning means you are telling mother the answer. This is called bad questioning. A good questioning means you are not telling the answer. You will ask, how about birth? How he was delivered? This is a good question. But if you ask, delivery was by normal or Caesar? At some point you are asking a normal investigation, abnormal investigation. So actually we are Asian, so our English is not that advanced like in British English. But trust me, this exam is an English exam. People who are used to talking Bangla and Arabic, please be careful. Failure rate is very high. If you don't express your English, failure rate is very high. Okay. So yeah, so Dr. Salma, you got your answer, right? That when you will ask this question and when you will ask other domain.
Yes, ma'am. Thank you so much.
Yes, thank you. Yeah. Any other
Ma'am,
question? Yes.
ma'am, I have a question.
Yes.
Suppose child is, I mean, we are unable to engage the child in our activity during the assessment. Then how can we say that he can order one order command, two order command? I mean, how to
I got
correlate that thing?
Yes. So you will give one order. Jack, can you take the doll or can you take the ball? Take it, Jack. See what a nice ball it is. This is one order command. You are giving the ball. When the child take the ball, Jack, give the ball to mom. Give the ball to mom. And while giving command, do not point your finger to the mother. If you point your finger to the mother, the child will go to the mother. But that doesn't mean he's following your command. That means he's following your finger. Okay. So during command, your hand should be closed. You cannot open your hand. Okay. You will give command. See the child is following the command or not. This child is not following any command. You know why? Not because of his age, but because of his behavior. He's autistic. Okay. But his other domains are good, like play. He's playing alone, solitary play. So solitary play comes at what, 1.5 to 2 year, right? So he's doing solitary play. But he's not following command. One order command comes at 2 year, two order command comes at 3 year, three order command comes at 4 year, right? So he's not following any command because of his autism.
Suppose, ma'am, after one order command, examiner says that he's not looking at you. So in that sense, what should we say?
No need to ask second order command because he's not looking at you means he's not following one order. So why should you go to second order? No need.
Yes. And one more thing, during the history, you gave an information that he's not sensitive to pain or he's not perceiving the any stimulus. So can you put some differential diagnosis of sensory processing disorder also in
Yes,
this?
of course. Yes, very good. Yes, why not? This is a child of autism. And autism children has sensory processing disorder that is called hyposensory or hypersensory. This child has hyposensory. He does not feel pain.
Okay.
Yes, of course. Why not?
Okay. Thank you.
So the differential diagnosis of this child was global delay. What is the cause of the global delay? Examiner asked Dr. Babur, what is the cause of the global delay? The answer is number 1, autism spectrum disorder related to tuberous sclerosis. Number 2 is epilepsy that can cause regression. Number 3 is neglect, lack of stimulation. Okay. Number 4, the cause of speech delay can be hearing defect. You must tell the examiner hearing defect. Okay. Until you say hearing defect, examiner will not give you full mark because any speech delay child, we are not sure hearing is okay or not. That's why we refer to the audiologist first. Then after audiologist, we refer to the speech and language therapy. So Dr. Babu did not mention hearing defect, hearing loss. Okay. And the other domain delay, like cognitive delay, may be associated with tuberous sclerosis actually, because the child has cortical tuber that can cause any domain delay. This child is a global delay child who has gross motor delay, fine motor delay, speech delay, and social delay. Top of the above, he has autism. So he is severely affected by both the condition. Okay, and in the investigation, you have to tell all the investigation related to global developmental delay child, including first we will do genetic study, that is RACGH. RACGH will pick up the gene defect. Then we will do the MRI of the brain that will pick up the tuber or any intracranial pathology. Then we will do some blood test. Some blood test means thyroid function testing, lead level. Now, lead is not so important because lead is important in case of old British house. Now the old British house are not available. Every house is new build. So every water pipe is not now lead. It's now the iron pipes, or it's not lead pipe. So lead poisoning is not mandatory. You can do complete blood count, peripheral blood film to check the lead poisoning, to check the fragmented RBC or something, polychromasia. And then you can do some blood tests like liver function test, renal function test, baseline test. Then you can do, this child had needed EEG. I think Dr. Babu mentioned EEG is needed this child because he has convulsion. And then you need to do hearing assessment, vision assessment is a must. So this is a part of investigation, and audiologist and speech and language therapist is a part of management. So you will refer to the audiologist and ophthalmologist. This child has tuberous sclerosis. So definitely there is problem in the eye, phacoma, retinal phacoma, isn't it? And there is problem in the hearing also, cochlear nerve. So you have to refer to these two specialists. And then some baseline blood test also, and organic acidemia, phenylketonuria. These are important if we don't know the case. For this child, we know already that it can be tuberous sclerosis. So metabolic screening in the blood and urine will be second line test for this child. But first line test will be MRI. Name of the genetic testing, we call it RACGH. Okay, RACGH. All right. So this is investigation. Management is, of course, multidisciplinary team will be needed. This child main team leader is the team member is the developmental pediatrician, then speech and language. But I will also refer to the audiologist and speech and language therapist. And then I will refer to the ophthalmologist. I'll refer to the physiotherapist for gross motor improvement, occupational therapist for the fine motor improvement. I can't remember Dr. Babar said